Okie doke. So let's talk about the muscles that are in the face and the neck. We're going to start with the muscles that are used for facial expression, okay? And some of the muscles, kind of like with the skeletal system, they're repeated. So you see them from different angles, or you see them kind of like in different places because of the taking off of different layers, but it's still the same muscle. So I'm going to go through them kind of as far as function and stuff like that first. And then as we get repeating those, I'm just going to mention them. Okay. So looking at these muscles, okay, I want you to notice that we've got the epicranial aponeurosis. That's a tendon. That isn't a muscle. Okay, so if it's a tendon or if it's a bone that's projecting out of somewhere, I'm not going to have you learn those. I want you to learn the muscles and where they are. Okay, so, and yeah, well, where they are. I'm going to tell you what they do for the benefit of learning that information, but I'm not expecting you to know that for the practical. Okay, so don't flip out about that. For the practical, I want you to be able to see a picture. If I point to something, tell me what it is. Okay, so we've got the temporalis muscle up here. Okay, it's right here, right at the temple. The temporalis elevates and retracts the mandible, and it does excursion. So your mandible elevates, retracts. So protraction is jutting forward, retraction is coming back. Okay, so it retracts the mandible, and excursion is side to side movement, like with chewing. The Occipitofrontalis, here and here. I want you to notice that it's on the forehead and it's on the back of the head here. And the reason that I mention that is because of what it does. It moves your scalp, raises your eyebrows, wrinkles the forehead. It does basically, it pulls this up and it can pull this down, but it's this back here that's actually pulling up in that look of surprise, and this side here that's pulling down. Okay, so when we talk about moving the scalp, that's what we're talking about. Sorry, the masseter. So the word masticate means to chew. Okay, so when we're talking about the masseter here in the cheek, we're talking about elevating and protracting the mandible as well as excursion. Again, close your mouth, pull your jaw back, and side to side movement. Okay, the sternocleidomastoid, there we go, that's the word I'm looking for. It laterally flexes the head and neck to the same side and rotates the head and neck to the opposite side. So where it's located at, it's going to flex, it's going to bend, make this angle smaller of the neck, and then it's going to rotate to the opposite side. Okay, so you've got this rotation motion and you've got this flexion motion side to side for the sternocleidomastoid. Now, the trapezius, I'm hoping you can see that laser pointer. I think you can. It extends and laterally flexes the neck. So if we're talking flexion of the neck, we're talking about this, okay? So extending the neck is going back like this. So it extends the neck and then does that same lateral flexion where it pulls the neck to the side, okay? Excuse me. The Orbicularis Oris, Orbicularis, orb, think round. We talked about the orbicular muscles being round. Oculi, that's of course your eye. So this closes your eye. Okay, so it's around your eye. So being able to wink, being able to, well, just blink, and being able to squint when it's bright outside, that motion is because you've got that muscle around your eye. Okay. The levator labii superioris. Levator labii superioris. Okay, levator. Think an elevator. Okay. Superioris. There we go. Superioris, above. Labii, lips. Okay, because that's what labii means. So the levator labii superioris is going to lift your lips. That Elvis. Okay, it's elevating your lips like for a sneer. Okay. The Zygomaticus Minor. Zygomaticus Minor is going to elevate and abduct the upper lip and the corner. So this is more the smiling motion because it's kind of at an angle. It's going to pull this way. Okay. The Zygomaticus Major is going to be basically the same thing. It elevates and abducts the upper lip and the corner of the mouth. Now, remember, abduct means to take away. So if this is the midline, our middle finger's the midline, abduct means it goes away from that midline. Adduct, you add it together. You're going to take this from this midline and bring them all together. So when we say it abducts, we're saying that it does that motion. Here's my midline. It's pushing it this way. That's why they say smiling, because that actually does pull this to the sides. The buccinator. The buccinator basically draws the corners of the mouth posteriorly. It compresses the cheek, and it's actually involved with holding food between your teeth when you're chewing. So, you know how when you can do that, so you can hold that cheek right next to your teeth? When you're chewing and you've got to push that food in between your teeth, that's what you're doing. You're chewing and you're using that muscle to kind of keep pushing it and pushing it back and pushing it back, even though your tongue is kind of pushing it to the sides. Excuse me. The Orbicularis Oris. Okay, it closes and purses the lips. Think kissing. Most orbicularis muscles are going to be like a drawstring where they're closing something off. So if this is around your mouth, this allows you to go, okay, it closes it off. And finally, we have the Depressor Anguli Oris. Basically, it is going to, oh man, brain fart. Hang on. Let me make sure I've got this right, because I think I've got it wrong. Okay, so think about where it's at. If you look at where it's at here, right? It's down here. It basically brings the corners of your mouth down for a frown. Okay? Okay. So those are the facial muscles and some of the neck. This is just repeated, okay? These are the same muscles, literally the exact same muscles that we just went through, but from a different angle. We did this with the skull. Remember, the frontal bone was here, but if you look this way, it's still right here. But if you look that way, it's still right here. Same type of thing. You've got the same muscles, just a different angle. Excuse me. Now, in your book, okay, they give you this with a whole host of other muscles that you can't see. Now, I will admit they are the deeper muscles, okay? They are the deeper muscles of the face, but I wanted you to have actual pictures of the muscles themselves, okay? So, the levator anguli oris, look at where it's at. It kind of does that same thing where it raises, I can't do the other side. It raises the corner of your mouth. So kind of that same sneery thing that we had going earlier, okay? We have the mentalis. Remember with the, excuse me, mental foramen, I said think of the thinking man, that guy that's sitting down thinking. Same thing, mentalis, it's going to be right here on the chin, okay? This elevates and wrinkles the skin over the chin. See how it allows you to pout, okay? The Oris, kind of toward the sides of your lips, the corners of your lips. This draws the corner of your mouth laterally, like when you're laughing, that pull to the side. The Procerus, it creates horizontal wrinkles between the eyes when you do that, okay, that pull down right here. The Nasalis, it dilates the nostrils. I think some people have a lot more control over this, but getting that to, I know people who can do that really well. I'm not one of them. The Corrugator supercilia, super, above, cilia, well, cilia. It depresses the medial portion of the eyebrow. Basically, when you do the and your eyebrows draw together here, there's one thing that's causing this to wrinkle, but this is the one that pulls your eyebrows toward the center. And then you've got the levator, labii, superioris, nasii. It elevates the sides of the nose and the upper lip. That, okay? The Depressor Labiai Inferioris. Again, look at where it's at. Look at the name. Depressor, down. Labii, lips. Inferioris, it's under the lips. Okay, it pulls this down. And then finally, we've got the platysma, which depresses the lower lip and then wrinkles the skin of the neck and the upper chest to express fear. That, this right here. You can actually see the neck kind of do this business. Yeah. Now, admitted, a lot of the muscles, and this is something that you're going to learn, in A&P, a lot of the muscles kind of do the same thing. It's like we have backups. We've got backups on backups on backups. We have several that kind of raise our lips into a smiling position. We have a few that kind of pull our lips down. We've got the one that does this and then this, that kind of do this motion with our face. We've got quite a few muscles that do the same thing. And that's okay. It's just that it's part of how this works. Your muscles, well, your body in general, always has things that are backed up. You've always got several things. We talked about this in chapter 10, when we said that we've got synergists being muscles that work together for basically a common motion. We said that the synergists all do the same motion, but there's usually a prime mover. There's usually somebody that does most of the work. So having several of these doing that same movement makes sense, okay, in the grand scheme of things. All right, so this is going to be part 1.